In many ICU cases, cardiac arrest does not occur completely without a warning. One subtle but important sign that clinicians sometimes overlook is progressive bradycardia in the setting of worsening hypoxia. When a patient becomes severely hypoxic, the body initially responds with tachycardia as a compensatory mechanism to maintain oxygen delivery to vital organs. However, as hypoxia worsens and oxygen levels continue to fall, myocardial and conduction system function begin to deteriorate. At this stage, the heart rate may suddenly begin to slow and bradycardia can develop. This is often a pre-arrest rhythm, particularly in respiratory failure. This pattern is commonly seen in situations such as airway obstruction, severe respiratory failure, accidental ventilator disconnection, or rapidly worsening lung pathology. Clinically, a patient who was previously tachycardic may suddenly develop falling oxygen saturation followed by a gradual decline in heart rate. If this process continues unchecked, it can quickly progress to pulseless electrical activity or asystole. Another important monitor parameter that may signal impending arrest is a sudden drop in end-tidal CO2 in ventilated patients. Because end-tidal CO2 reflects pulmonary blood flow and therefore cardiac output, a sharp decline can indicate that circulation is collapsing. This may occur in mesople PE, severe hypotension, or during the moments leading up to the cardiac arrest. Recognizing these patterns early is critical. When clinicians notice worsening hypoxia accompanied by bradycardia or a sudden drop in end-tidal CO2, immediate evaluation of the airway, breathing, and circulation is essential. Rapid interventions such as securing the airway, improving oxygenation, addressing ventilator problems, or initiating resuscitation can sometimes prevent full cardiac arrest. In critical care medicine, the monitor often shows the warning signs before the patient actually arrests. The key is not just watching individual numbers, but recognizing the trend and physiological story behind them.